Right now, we're moving on to the US and we would listen to Isla, who will be telling us about the American experience. Recently, we had some global statistics about the 10 countries that were worst hit by COVID-19. And the US tops that chart. Also on that list, we have Russia, Brazil, and a couple of other countries. But then it's important that we listen to Isla, and I can assure you, Isla, that even before your session begins, there are quite a number of questions for you already. So right now, let's listen to our final panelist, Dr. Isla Durkin.
All right, it's nice to be here. And I appreciate the accolades, Dr. Ayo. So how does the pandemic look like in the US? Well, first of all, it feels like we're constantly reminded about it, not just outside of the home, but in our homes, on the TV, even when we're trying to relax and watch TV, the commercials constantly remind us about these trying times. When I leave the house, everyone is in a mask. Oftentimes before you go into somewhere, they do a temperature check to make sure you're not running a fever. If there's too many people in the building, you have to wait outside, wait 6 feet apart. Weddings, meetings, birthdays, parties have all been canceled. Most things are virtual. And so what am I doing? And also what do I tell my patients to do to help with this, added stress and anxiety is there are 5 different things. First of all is shut off the news. You don't need 2 to 4 hours of pandemic news to know what's going on. That's just going to increase your anxiety. I tell a lot of folks, you just limit it to 10 minutes. Get your 10 minutes of news. You can definitely catch up on things in 10 minutes. And it's preferable to use a reputable news source, someone that, you can check their sources. Social media is a good place to go if you can sort through all the rumors and hoaxes, but it's not the preferred place to get all of your news from. And then secondly is keep taking care of your general health. Go to your regular checkups, get the screenings done that's recommended, based on your age and gender. Get your vaccinations. If your mind and your body are connected, and so if you're not taking care of your body, it's very hard for you to not be stressed and anxious. And so take care of your diabetes, your high blood pressure, sleep apnea. Those are some big ones, definitely here in the US. Among healthcare providers, a big discussion is that there have been fewer cancer diagnoses and fewer people coming into the hospital for strokes and heart attacks during the pandemic. And it's not that the pandemic has magically cured those things or lowered those numbers. It's that people aren't getting the help that they need, aren't coming into the hospital. So it's important to, keep up with your physical health. Number 3 is you have to prioritize your sleep. Sleep is very important. I tell all my patients to use sleep hygiene. That's my first go-to before trying any medications. Sleep hygiene is just a fancy way of saying good sleep habits. So, keeping a consistent sleep schedule, even on the weekends, even if you're working from home, is very important. Having a relaxing bedtime routine is important. Some of the things that can make it hard for you to get good sleep is if you're drinking caffeine after lunchtime, because that can stay in it takes a while to take effect and it stays in your system for a while. So if you're having a cup of coffee at 6 p.m. with dinner, which is, what time I have dinner, that's going to make it hard for you to fall asleep later. If you're having 2 or more alcoholic drinks every night to calm down and go to sleep, that might be contradictory. Having too much alcohol disrupts your sleep architecture, which means you're not going to get good sleep. you're not going to get that good deep REM sleep that you need. Another thing is having nicotine right before bed. Either vaping, cigarettes, or chewing tobacco, that's going to ramp you up, make it hard for you to fall asleep. Taking naps during the day. If you're napping during the day, it's going to be harder for you to sleep at night, which is, it's tempting, but it's a vicious cycle. And then the number one thing is having screen time in bed or right around bedtime. The light from those screens, your phone, laptop, TV, comes in through your eyes and tells your body that it's time to be awake. So I know that I'm guilty of it. Most people I know are guilty of it, but it's best to keep your phone out of your bedroom. All right, and then number 4 is exercise or physical activity. It would be ideal if we all got 30 minutes of strenuous exercise 3 times a week, but that's not realistic. The vast majority of people are not going to start an exercise routine. Even though it's good for us, it's not realistic. So just go outside every day, get a 5-minute walk. Don't call it exercise, call it physical activity, moving around. And if you can, get your physical activity outdoors, that's even better because the vitamin D from the sunshine really affects your mood as well. And then number 5 is mindfulness. I have a lot of people tell me that they've tried this, it didn't work. They, can't sit and think about nothing for 60 minutes, which I don't blame them, no one can. So mindfulness, there's a big range from deep breathing, yoga, guided meditation. You can find guided meditations for free online. But one breathing exercise that I really like, it just takes a minute, is where you breathe in through your nose for 2 seconds. You hold for 2 seconds. You breathe out through your mouth for 2 seconds. And you hold for 2 seconds. And you do that 3 or 4 times, once a day. And amazingly, it really, really does wonders for your mood. So find what works for you. And then lastly, just remember that you're not alone. The entire world is going through this with you, with the pandemic. I guarantee you someone else is feeling the way you are. Talk to your friends and family. They can relate. If you feel like you need more help, tell your doctor. Just don't be afraid to reach out and ask for help. Thank you.